Hello, and welcome to Smart Legacy Planning. Today we are going to talk about Medicare in the simplest way possible, because for many people, Medicare feels confusing, overwhelming, and full of complicated terms. If you are close to turning 65, helping your parents with healthcare decisions, or planning your retirement in the United States, this video will help you clearly understand what Medicare is, how it works, and which parts matter most for you. Medicare is a government-provided health insurance program mainly designed for people who are 65 years or older, although some younger individuals may also qualify due to disabilities or specific medical conditions. The purpose of Medicare is to help cover essential healthcare costs, but it is important to understand from the beginning that Medicare is not completely free and it does not cover everything. Medicare is divided into four main parts, known as Part A, Part B, Part C, and Part D, and each part plays a different role in your healthcare coverage. Let us start with Medicare Part A, which is often called hospital insurance. Part A mainly covers inpatient hospital stays, skilled nursing facilities, hospice care, and limited home health services. For most people, Medicare Part A does not have a monthly premium because they paid Medicare taxes during their working years. This makes Part A feel like free coverage, but it is important to know that even Part A comes with costs. There is a deductible for hospital stays, and if you stay in the hospital for a long period, you may have to pay daily co-insurance amounts. Part A helps reduce large hospital bills, but it does not mean hospital care is completely free. Next comes Medicare Part B, which is known as medical insurance. Part B covers doctor visits, outpatient services, preventive care, lab tests, mental health services, and many medical supplies. Unlike Part A, Part B usually requires a monthly premium, and the amount can change depending on your income. Part B also has a deductible, and after meeting it, you typically pay a percentage of the cost for services. Many people underestimate Part B, but in reality, it is one of the most important parts of Medicare because it covers everyday healthcare needs, regular doctor visits, and early detection through preventive services. Skipping Part B can lead to lifelong penalties, so understanding when and how to enroll is very important. Now let us talk about Medicare Part C, which is also called Medicare Advantage. Part C is offered by private insurance companies that are approved by Medicare. These plans combine Part A and Part B coverage, and many Medicare Advantage plans also include prescription drug coverage, vision, dental, and hearing benefits. Medicare Advantage plans often work like managed care plans, meaning you may need to use specific doctors and hospitals within a network. While some Medicare Advantage plans have lower monthly premiums, they may have higher out-of-pocket costs when you need care. Part C can be a good option for some people, but it is not always the best choice for everyone, especially those who want more flexibility in choosing doctors. The final part is Medicare Part D, which covers prescription drugs. Part D plans are also offered by private insurance companies, and each plan has its own list of covered medications, known as a formulary. Without Part D, prescription drug costs can become very expensive, especially for individuals who take medications regularly. Like Part B, delaying enrollment in Part D can result in penalties that last for life. Choosing the right Part D plan depends on your specific medications and pharmacy preferences, which is why reviewing plans each year is important. One of the most common mistakes people make with Medicare is assuming that it will cover a